Welcome to Notes on Arrival. We are usually an audio podcast, and this is our first ever video. Today, we're going to be doing a two-part Ask Me Anything. Today, for part one, we're going to be covering conception, pregnancy, and birth. So we got some questions from our listeners and friends, so let's dive into it. Margo, why don't you read the first one?
Awesome. Thanks, Gwen. So the first question is, did you ever feel ready to start trying? Ready or not, what made you decide to start?
I don't know. I think for me, I knew I wanted kids, but it's such a big change. Yeah. I don't know if I was ever fully ready. I think for me, I just figured let's just see what happens and go from there. I always say to my friends, if you're already thinking oh, we're going to have kids, when am I going to be ready? Or maybe we'll be ready soon. That's as ready as you're ever going to be. So that's kind of my perspective. How was it for you?
Yeah, I like that. I think for us, no, I never really felt ready. That's just something that I knew I wanted for so long. That was yes, I want to be a mom. We know that this is something we want to do. And we had gotten married, and I was insistent upon getting married before having kids. And it was once we got married, it was okay, I guess we're going to do this now. Or are we really going to do this now? And I was very nervous about finances, but it was we'll make it work.
Yeah. I feel anything with having kids, you just figure it out as it happens. Yeah. You add another kid and you're how are we possibly going to do this? And then you just do. I think for me, the second part of that question, what made you start trying? I think for me, my husband really was ready before me. And I think I had just gotten to the point where either he had worn me down enough or I was just okay, I could do this, I know it's going to be really hard, but I can do it.
It's funny that I feel for both of us, it was our husbands were ready first, which I think makes a lot of sense because it's we have to do so much more work.
Yeah, especially before the baby comes. So.
Yeah, exactly.
What else we got?
All right, next up. Did you take any steps to prepare while you were trying to conceive?
The only thing that I really did was I took my IUD out, and then I started taking prenatals pretty much right away after that, knowing that I was going to start trying within 3 to 6 months. That was kind of it, though. I was honestly super lucky that my conception journey was quick and easy. I know that's not the case, that's not the experience that everyone has. So yeah, I didn't have to do much to prepare. What did you do?
That's awesome. Good point on the prenatals. I would have forgotten to mention that. I had taken my IUD out and I was taking oral contraception and then stopped taking that about 3 months before we were going to start trying. I was very by the book. I didn't drink any alcohol while I was trying for the first few months.
I did not do
that. I was really trying to be very, very, if there was any possibility that I was pregnant, I was not going to drink.
Yeah.
And then I stopped doing that and then I got pregnant.
Yeah, maybe don't get too into the prep.
Yeah, and I think that was overkill, to be honest. I think that putting that much pressure on it, because then everyone would notice I wasn't drinking and everyone was oh my God, are you pregnant? I'm no, we're just trying. I heard something recently, I don't remember if this was you telling me this, but someone said something that your morning sickness is based on the health of the father.
I don't think I knew that.
And that he should be eating healthy for about a year before you even start trying, and that can impact your morning sickness. I have no idea if that's true, but
well, there's so much about the health of the father also impacting your chances of conceiving.
Yeah, exactly.
So, I mean, if not just to help your wife from not feeling super sick all the time when she's pregnant, it does increase your chances of having healthy sperm and conceiving more easily. All right, let's get into some of the pregnancy questions. Cool. This listener asked, what literature did you find the most useful during pregnancy?
There are 2 books that I love that I consider my birth Bibles. And actually, I'm going to fold in a third. The first one is Ina May's Guide to Childbirth.
That's our favorite book ever on this podcast.
We talk about that book all the time. For those of you who aren't familiar, Ina May is a midwife, a traditional midwife. The first half of the book is birth stories.
Love that part.
And it's so great. It's all birth stories of women who Ina May assisted or her midwives helped with.
I will say, too, what I like about the birth stories is that they're not all super positive.
Yeah.
I think there's very few of them that are very triggering, but it does really paint a picture of the diversity of birth experiences that women have.
Yeah. But what I will say that it's lacking is that it's all women who gave birth on the farm, which is where Ina May practiced. And while I think that that's valuable, you are getting a very specific kind of woman. And I think ultimately that's part of what we're trying to do with the podcast is share all kinds of birth stories.
Yeah.
So that's the first half of the book. And then the second half has a lot of really great conception, pregnancy, birth information that
I like anatomical, physiological things that are happening.
Yeah. Like a lot of really helpful information about like all of the hormones she breaks down. Yeah. It's fascinating. So that's number 1. Number 2 is Expecting Better by Emily Oster, which I have mixed feelings about Emily Oster right now, but we won't get into all of those. But that book is fantastic. She goes into like the research that exists related to pregnancy and then breaks down and birth and breaks down like the research in really tangible way. Really, really fascinating book and really helpful if you're someone like me who's very like data driven and wants the numbers. Like, for example, I think you can have a cup of coffee a day while you're pregnant. Like research supports that. It's totally fine. Yeah. The third one that I love, which I read the second time around, is Birthing from Within. I would sooner recommend it to first-time moms than second or third or fourth or fifth or sixth. It's really about like doing the internal work and like what you personally need to address in order to like go through birth and like what is it? Matrescence?
Yeah. Matrescence is like it's like adolescence for moms. So it's like as you become a mom.
It's like the birth of the mother. It's about like going through that process in an emotionally safe and healthy way. It's beautiful. It has a lot of like activities and a lot of like drawing and like just a lot of internal work for you to do. That's why I think it's better for first time moms, because second time around you don't have as much time because you have another little one that you're already taking care of.
Yeah, and you've already been through a lot of those steps in some ways.
Definitely. How about you?
I mean, honestly, Ina May's Guide to Childbirth is, my birth Bible. But Ina May's other book, Spiritual Midwifery, I read for my second pregnancy, and I loved it. It's a little bit more on, like, the crunchy side. It's pretty crunchy. So, like, having already had one, like, unmedicated birth and knowing I was going to do my second birth also unmedicated, and the second time not even in a hospital, I was like, I'm going all in. I'm, like, just reading these birth stories. But they, again, like, there was a broad range. Like, there were some stories where women on the farm in this like rural birth center, they end up, in a hospital for a C-section for some medical reason. So I think it did also kind of showcase like medical reasons why sometimes intervention is safer, and also like amazing that it's an option for us. Also for my first, I read Natural Hospital Birth. I was birthing in a hospital and knew I wanted to do unmedicated. So I just felt like the name just kind of drew me in. It's kind of straightforward. But yeah, no, it was helpful. It did a lot of the kind of like explaining the interventions that exist in hospitals and the pros and cons and considerations. So it's sort of like you might go in knowing I want an unmedicated birth, but then there's all these other things that come up and maybe different systems and, staff that might be influencing how your birth goes, and how can you navigate what you want, what you don't want. Why are you making these decisions? Because maybe you're like, maybe I am actually open to this intervention. So yeah, I thought that was really helpful. All right, let's go to the next one. What scared you most about getting pregnant and having a baby? And did your experience debunk any of those fears for you?
Yeah, so I talked about this a bit on our second episode when I talked about my birth story with my son. First of all, I was afraid of giving birth. Like, let's be honest about that.
I mean, it hurts.
It fucking hurts.
Like, no one wants to be in pain. So you're like afraid, anticipating what is going to be painful.
Yeah, I was very afraid of giving birth. But I will say that like reading those books that we just talked about, learning more about birth really kind of helped that fear. Yeah. And I think it was something that was really valuable. I was petrified of tearing. I
remember you said that.
Yeah, no, I was so afraid of tearing. I don't know why I was so hung up on that.
I think it's just like a common injury that happens. Yeah. So you're just like, no, it's going to happen kind of, because most first-time moms do tear when they birth vaginally. Yeah. Most of the time it's not severe, but I think it's that same thing where it's like, you're about to be in pain, or like, you're about to tear.
I think it was also, I first learned about tearing from my husband's cousin, who then when she got stitched up, they like fucked it up. And like they had to redo it. So I didn't even know vaginal tearing was a thing before I had that conversation.
And that was
with
like
her.
The first story you heard.
Yeah, exactly. So I think that like scarred me.
Just like everyone has 3 different vaginas.
But the thing that really scared me most was becoming a mom. I was like, can I handle this? Like, will I be a good mom? And that was really scary to like reconcile. What's funny is, and then my son was born after a very long, intense labor, and they like slapped him on me, and that fear just like evaporated. It like totally went away. That's what scared me most. And I think it's normal to like have some sort of fears around birth. How about you?
Yeah, I mean, again, I think like same as you, I was totally afraid to give birth. I think like before I got pregnant, I was like, oh my God, like being pregnant and giving birth is like going to be terrible, because I feel like that's just like the narrative that so many people have. And a lot of people who want to share their birth story want to share their trauma, which is the sad truth that also like in our society, that's so common.
Yeah.
And I don't think it's normal. Just because it's common doesn't mean it's normal.
Nope.
Yeah. So I think I was just like, what if something goes wrong? Like, I think I was just afraid of the what ifs. And it took me a long time. It took me a lot of reading some of the books we mentioned, and just a lot of kind of like emotional and like almost spiritual work to kind of be like, you can't live in the what if. Like, you can only live in what's actually happening in front of you and dealing with it as it comes.
Yeah.
And I think having that, like being able to shift to that mindset was really helpful. I think at the very end of my pregnancy, I remember being on the phone with my doula when I was like 40 weeks pregnant. And I was like, I feel like I'm not like connecting with my baby, and like I didn't feel like I had an emotional connection with my baby, which like some people will be like, oh, I'm like connecting with my baby every night, and like we're talking, and like I'm, you know, before the baby comes, like when they're still pregnant. And I'm like, I didn't feel like I was doing that, and maybe I didn't feel like I was doing it right. So I was like, what if this means that I'm not going to be like a caring mom? You know, I thought it would translate into motherhood, but I don't think that's true. Like, I think it's a different journey for everyone, but I think it's really hard to not love your baby. So if you're feeling that, like, you're going to be fine.
I loved talking to my babies, like in the womb. I talked to them all the time, especially my daughter. But I think that I feel like there's just so much pressure. Like like feeling like I'm not doing it right.
Right.
You know what I mean?
Right.
Like, it wasn't about like doing it and like for whatever reason. Like, I just did it because like I'm a chatty person. There's a reason we have a podcast.
You're like, I have to talk to someone.
Yeah, exactly. But you know, there's so much pressure on like what things are supposed to look like and they're supposed to be. But of course, I mean, you're an amazing mom.
Oh, thank you. So are you.
Thanks.
Our kids are together this weekend. Okay, last one about pregnancy. How did you decline interventions or medical recommendations, especially with pushy doctors?
I love this question. And I think it's something that you need to be really prepared for. So again, like, get educated. Getting educated and learning about like what your options are. What do things mean? The first time around was working with an OB until I was about 25 weeks, at which point I realized that like that wasn't going to give me the experience that I was looking for and what I wanted. So I guess like that would be the first thing, is finding a provider who's going to like support you in your options and educate you. But then I had a very pushy midwife during my birth who I had done a ton of research about Pitocin. Pitocin is synthetic oxytocin. It helps to augment labor or start labor. And they sometimes give it after birth to help with the delivery of the placenta. And I had done a ton of research and I knew that I didn't want that. It was on my birth plan. I gave it to her and she asked me about it. And I was like, no, I am declining to Pitocin after delivery. And she pushed me and she gave me all this anecdotal research. And I was like, okay, I've done actual research, like not anecdotal evidence. And
not to say that there isn't value in anecdotal evidence.
Not to say that there's not, but like one midwife's experience, like, yes, she helps people deliver babies all the time. But I knew in my heart what was right for me. Yeah. And
I was going to say also, like, you don't know what those women's labors were.
Exactly. And what I said was, if it is medically necessary, if I am hemorrhaging, yes, obviously give me the Pitocin. I'm not saying, of course. But if it's not medically necessary, I'm declining this. Yeah. So I think it's like being firm in your conviction. I think that this is where a doula can be helpful. And I also think that this is where your partner really needs to like know your birth plan and advocate for you, because you might not be in a space at that point where you can advocate for yourself.
Yeah. No, I think that's smart. Yeah, I feel like for me, I honestly was lucky. I didn't have a ton of instances where I had to decline or like deal with someone who was really pushy, but I definitely think my doula was really helpful. There was a nurse that was like very by the book and was like insisting on continuous monitoring when my birth plan clearly stated intermittent monitoring. She very quickly got the nurse to, abide by the birth plan. We took the vitamin K shot. Mm-hmm. We said no to the eye ointment. We said no to Hep B. And there's doctors there that are like, are you sure? Like, there's a lot of research around why like this vaccine, the moment your baby's born, is good for them. And I was like, I'm going to make that choice for what I think is better for my family. It's not necessarily like I'm declining it altogether. It's just, I didn't want it that day. And same with the eye ointment. I had done research and knew that there was no reason that my baby needed it. So I think it's just like staying firm. And I think what you said before, like, is this medically necessary? Like saying that is like a really good way to either prevent like delay or decline medical intervention.
Yeah. And I think the other thing that like doing the education beforehand, I love those examples that you gave, because it's like those are standard policies in many hospitals that like that's what your baby's going to get immediately after birth. And Lucia is almost 8 months old. She still hasn't gotten Heppy. Like she's not being exposed to needles. You know what I mean? Like
it's just like not, there's not a sense of urgency with some of these things.
Right, exactly. And that was something that like I didn't realize the first time around. Honestly, it was like I just kind of went with it because it was standard hospital policy. So I thought that that meant that there must be a medically necessary reason for it, or evidence-based reason for it. And then I found out there wasn't. Yeah. So I think like, yeah, just because something is like common doesn't mean that like you have to do it or there's a good reason to do it.
Yeah, totally. And I think that's also a good thing to remember when it comes to just like parenthood and kind of as you're going into motherhood and making decisions for your family and your children that fits for you and isn't necessarily like what is the default in society or what a doctor or provider says for whatever reason.
Yeah, absolutely.
Should we get to the birth?
Oh, that's all the pregnancy was. Okay, yes. Birth, our favorite topic.
This is really what we're here for.
What did you feel was the most important thing you did to prepare for birth? Not logistically, but physically and mentally.
Honestly, for me, it was listening to and reading birth stories. I know that this is going to sound self-promoting because our podcast is mostly birth stories, but the reason that we wanted to create a podcast that was mostly birth stories is because of how much value we believe listening to and reading and absorbing birth stories are when you're pregnant, even after you have a baby, if you're thinking about another baby, or even if you're just thinking about getting pregnant, or even if you're a mom, you just want to like find a community that's talking about something that resonates. Yeah. I think for me, like really listening, like reading all the birth stories in Ina May's books, listening to podcasts that had birth stories, talking to other women about their experience. I feel like that was really helpful. I think physically, I just tried to stay as active as I could, especially for my first pregnancy. Like I would really indulge in some of my cravings. Like I definitely gained a little more weight the first time because I was like cupcakes.
I did that both times.
Yeah. But I also was like, okay, I can eat my cupcakes, but also I want to like still go to the gym and like still go to yoga. And like I was hiking often. It was the winter in Arizona. It was like beautiful out. I was like, let me get fresh air. Let me like walk uphill. And I think that was also a way to just like really not just, obviously like there's mental benefits to working out, but obviously staying strong, staying limber, and just like preparing my body for birth and just kind of accepting that like whatever's going to happen is going to happen and we're going to figure it out and we're going to work through it, not living in fear, not living in the what if, and just like trying to change that mindset to be really positive and be like, I'm so excited to experience this incredible thing, which like birth is painful, birth is super hard, birth is transformative, but it's like also this incredible, beautiful thing.
Yeah, definitely. I think the like part you said about like preparing physically is really important because I feel like at least I had this notion of like pregnant women being fragile, but like you're not. Yeah. And birth is physically the hardest thing that I have ever done in my life. Like
same, by like a long shot.
By like I had said that after my first birth, I said everything else in my life had been like a 1 or a 2 and birth was a 100. Like it was so fucking hard physically.
I've even talked to women who've done like marathons and like really intense physical like exertion activities and they still were like giving birth is way harder.
Yeah. So I think the like preparing physically and like working, you know, learning what you can do and like how to exercise in a safe way, but like continuing to be as active as possible. Yeah. I also attribute that to like in my first pregnancy, I didn't have a ton of pain. You know what I mean? Yeah. Like people talk about like pain and feeling uncomfortable. Second one, less so. And I think that that's partially because your body has done it before, but like still not that bad. But I think the like preparing physically, I like did yoga my whole first pregnancy. And the second time around, I was working with a personal trainer my whole pregnancy. Yeah. And walking a ton both times. Mentally, I agree. I think listening to birth stories, but I want to add also a little bit of a caveat, which is like purposefully seeking out positive birth stories or like avoiding traumatic ones. Yeah.
Not something, you don't want something that's going to be triggering because then it's like impossible to let go of that fear and what if.
Yeah, it's awful. There were definitely a couple of people on Instagram I had to unfollow because it was like the shit that you're sharing. I appreciate that you're giving voice to these things, but like this is not what I need to be inviting into my space right now.
Yeah, not in that moment. It's not for you.
Yeah, exactly. So I think surrounding myself with like positive birth stories and just doing a lot of like positive affirmations of like I can do this. Yeah. Yeah, I think it was really helpful.
Actually, something that I did before my second birth to prepare mentally was I just wrote down like everything that I was like afraid of or like resistant to. And I was like, I'm afraid that my baby is going to like take too long, or I'm afraid my labor is going to require me to transfer to the hospital, or something's going to go wrong. Like just any fear that I had about like what could possibly come up, I just wrote it down and then I like burned the page.
I love that. That's awesome.
I think I just like needed to let go of those fear. It wasn't even fear. It was more like anxiety.
Yeah.
Just like I know so much now about birth because I'm so obsessed with it. So, it's like, of course, I think it's this amazing thing, but like it is also this like really crazy process where there's a ton of stuff that can happen along the way that can make it more complicated than what I've been lucky to experience. So that's a good one too.
Yeah, it's miraculous.
Journaling.
I did something similar with my first too. I like wrote down all of my fears and everything that I was feeling about like afraid of becoming a mom. I didn't burn the page, but I wish that I had.
Yeah.
But actually, I like looking back at that now. No, I enjoy reading it. Like
nice.
I don't know, it grounds me in a little bit.
That's cool.
You started to talk about this a little bit, which is, did you prepare differently for the arrival of your second versus your first? And if so, how?
I mean, like, I didn't. I'm just kidding. I mean, I did a little bit, but like anyone who has 2 kids who has prepared for birth in some capacity knows with your second, like you just have no time. Like you're chasing a toddler around or a kid, depending on the age gap. So I just prepared less, I think. I did still find time to read, and I did still find time to like make some space for just me and the baby I was pregnant with. But yeah, it was just different. It wasn't until like halfway through my pregnancy that I was like, oh, I'm going to be giving birth. Like, like that I was like accepting that was going to happen again, because it was just going a lot faster.
Yeah.
So yeah, I guess my preparation was just more minimal the second time. What about you?
One thing that you also kept saying to me, because our kids have like a similar age gap, when I was like, Gwen, I don't have time, I'm not prepping for the birth of my second at all. You were like, but you just did this.
Yeah.
That was something you said it to me all the time. You were like, but you just did this. Like your body knows, like you're fine. Yeah.
Yeah. And also like, because your kids are 18 months apart.
19
months apart. Mine are 20 months apart. Yeah. It's like, yeah, you can like read those books again or read different ones that are a similar, you're learning similar things and from a different perspective. But I think at the end of the day, like, yeah, if your kids are that close together, I think it's like, oh, what are some of the things that I didn't get to do the first time that maybe now I can work into my much more busy schedule? I
think that the other thing is I was very intentional about my birth due my second time around.
Same.
Yeah. And I think that like, you just know, having done it the first time, like both of us gave birth in a hospital our first time with midwives, but you just know that like still things can happen and you still need to advocate for yourself. And I was like, I don't want to go into birth with my boxing gloves on.
Yeah. That's why I chose to birth out of hospital the second time.
And for me also, I tried to deal with the emotional part more than I did the first time around, which is part of what like birthing from within was really helpful for. And like I exercised differently the second time. I was like, I'm going to lift weights the whole time because like I can. And now I have this diastasis recti that is like not good. And I'm like, is that because I was lifting too much?
I was doing a lot of yoga the second time because I don't live in a place where I can like hike as easily as I was the first time. But honestly, I feel like I was a little stronger and more fit the second time. So I don't know.
Yeah. You did it.
I did it.
Cool. Well, those are all the questions that we have on conception, pregnancy, and birth.
Yeah. So we're going to do episode 2, and that one's going to be all about postpartum and motherhood. So definitely check it out.